According to Bernie Sanders, the increase in taxes for funding the Medicare for All proposal is evened out by citizens not needing to pay for premiums, deductibles, or other out-of-pocket expenses. However, the Heritage Foundation did the calculations and determined this claim is not accurate. Households that receive employer-sponsored coverage would see their income after taxes shrink by an average of $10,554, and 87% of them would be financially worse off. The foundation also explained that lower-income working families, which currently get health care through government programs like Medicaid and CHIPS, would have their average household income after taxes decline by $5,592 per year. The raising of taxes, even with the diminishing of other expenditures, still does not equal out. While the main rebuttal against Sanders' proposal lies in the unsustainable costs, some politicians have been using the COVID-19 pandemic as a primary reason for the need for federally funded health care. According to New York Times writer Farhad Manjoo, Republicans are siding with Medicare for All only as a temporary response to the pandemic. Manjoo states, "Everyone is a socialist in a pandemic." Responding to a pandemic by creating allowances for testing at no cost to the citizens, like in New York, is a reactive measure. If the measure taken during a pandemic were applied consistently, then that moves from reactive to proactive and a potentially permanent means of restricting freedom. While measures need to be taken to be more prepared for future pandemics, COVID-19 cannot be the primary support to push this proposal forward. The proposal offers a socialized medicine, which does not provide the benefits desired. According to Mark Stein, a story he shows of a guy who went to a Quebec emergency room, waited for 6 hours, was told he had a migraine, and then sent home. It later turned out to be a life-threatening parasite in the brain. According to Stein, a chronically harassed, understaffed, under-equipped system reaches reflexively for routine diagnosis and prescriptions. Because Medicare for All is financially unstable, it also limits where funds go. The limitations of funds leads to limited providers, which creates longer wait times and less accuracy of diagnosis. It begins to put a price tag on human lives and those who are deemed to have a better quality of life to be the ones served first, because they're the ones where the resources would be considered best used. The decision no longer becomes that of the citizens, but that which can be afforded. Returning back to the coronavirus as a main reason for the need of this kind of proposal, COVID-19 was an unexpected occurrence for every nation in the world, regardless of preparedness or access to health care. Access to free health care would not prevent people from dying of a virus that currently has no affirmative cure. A pandemic should not be used as a reason to promote a program that would continue to damage the American economy and remove national freedoms like privacy and choice for the long term.